Brady here. I'd like to spend a few minutes to explain to you what we do differently here at our office and why we get the great results that we do. The first thing I should probably say is that we do things very differently here. In fact, we do things differently from any other doctor or healthcare practitioner you have been to. And I guess the most striking difference about what we do here is our philosophy, which is treat the patient, not their diagnosis. Now, every single day, thousands of people go misdiagnosed, anywhere from strep throat to cancer and everywhere in between. So what we need to do differently is we need to step back and step out of the classification name of the diagnosis. Yes, that can help us find a good start, but it tells us nothing to do about what's going on with you. For example, if someone comes in with a condition called hypothyroidism, now the endocrinologist is going to run one test and say, here's your Synthroid. And they're not going to explore any other reason why that person has hypothyroidism. Can hypothyroidism be promoted by intestinal issues? Yes. Can it be promoted by hormone issues? Yes. Because here's the deal, is that all the systems in the body work together. They don't work separately. However, we have a healthcare system that has specialists, that they look through you with their microscope and say, all right, I'm the endocrinologist, so something's wrong with your hormones. I'm the neurologist, something's wrong with the brain. And what happens is that they put you on a treatment, and the majority of the time, there's very little improvement because the big picture has not been looked at. So what are we going to do when you come into the office? Well, we're going to look at everything. We're not going to waste 10 more years, which most of you guys watching this video have been through. You've been to doctor after doctor after doctor, years after years, feeling terrible. So what we're going to do is that when you come in, we're going to do a very in-depth exam. In fact, this is going to be the best exam you've ever had, okay? We're going to do a neurological. We're going to look at your brain. Why are we going to look at the brain? Well, the brain controls everything. And the brain is kind of like a muscle. It has two sides, okay? Now, when one becomes stronger than the other, what happens is we start to have an imbalance. And the communication with that imbalance starts to screw up everything in the body. So we have to do a full neurological exam. We've got to look at the specific areas in the brain that aren't functioning well. Because once we figure out those and we apply a neurological rehabilitation, you start to see a lot of symptoms go away. You start to see your brain functioning better because the key areas in the brain have now been identified, and now we can work with them to get them better. What else are we going to look at? Well, we're going to look at hormones. We're going to run a full blood chemistry. Okay? We're going to take this information and we're going to do it all at once. We're not going to waste another year. We're going to do everything that we think that we can get the best amount of information out of and run them. So we can say, all right, this is what's going on. Here's a plan we can do it. So as far as treatment goes, we're going to do some neurological rehabilitation in the office, but I'm also going to give you a home plan to do because this is going to take dedication and some time to get better. Also, there's going to be dietary changes. There's going to be lifestyle changes. There's even going to be a personalized supplementation plan based on these tests that we run to say, all right, here's your chemical imbalances, okay? And then this is what's going to help balance itself out. And that's why we get the great results that we do. Just to give you another example, we had Billy, who came in and he has autism and he hasn't been able to speak. So we come in, mom brings him in, been on this med, just nothing. The kid won't even talk. He sits and plays with one toy and that's it. He doesn't talk to anyone, right? So what we do is that we do a neurological exam. We find some different areas of the brain that just were not working very well. We ran some blood tests. We also ran a few genetic tests. One in particular, we ran a genetic test that shows his risk of developing gluten sensitivities. And all that came back positive. So was his food allergy test that came back positive. All these things that we look for, this kid was really messed up. But it gave us a plan. Within about 2 months, this kid was talking again. I gave him some neurological stuff to do at home, and he came into the office, and we worked with him there. And we used his food allergy test to get him away from the foods that he's really sensitive to. That was basically destroying his brain. And within 2 months, this kid had his life back. So that is the same type of approach that we take with every single case that walks through our office, no matter their diagnosis. You could have insomnia. You can have hypothyroidism. You can have cardiovascular issues. It doesn't matter. What matters is the information that we get that gives us the big picture of the plan. So I hope this helps out, and we look forward to seeing you in our office. Again, I'm Dr. Brady Hurst with True Health, Center for Functional Medicine.